Greetings everyone, I'm Alan Christensen and I'm the chair of the Department of Psychology at East Carolina University. I want to thank you for taking the time to get to know our department and our graduate programs a little bit better. All of our programs in psychology at East Carolina are devoted to excellence in training the next generation of psychological scientists, practitioners, and educators. And I think one of the many things you'll find that sets our graduate programs in psychology apart at ECU is that we have the flexibility to tailor a graduate experience to an individual student's training needs and overall career goals. So take a look around, and if you have questions or want more information, please don't hesitate to reach out to me directly or to any of the graduate program faculty. We hope to see you on campus at ECU soon. In the meantime, stay well and go Pirates.
Hi, I'm Dr. Sam Sears. I'm the director of the Health Psychology program here at East Carolina. We are excited about putting together this tour because we know that when prospective students see our campus, meet our faculty, and see the opportunities, there's no place else they'd rather be. East Carolina represents a university that lives its mission. It actually tries to do the things that it talks about. It actually tries to serve the students and the region and the people of this region in every way. Learning health psychology here will transform you from a layperson to a professional. It's a profound transition, but it's one that our faculty and this university are committed to achieving. Have a long look at East Carolina, and it won't be long until you want to be a pirate. Thanks very much.
Hi, I'm Dr. Rob Carrolls. I'm the Director of Clinical Training for the Clinical Health Psychology concentration. Chances are, if you're watching this video, you're probably interested in attending East Carolina University and maybe even interested in studying or getting your doctorate in clinical health psychology. I just want to say, I applaud that decision. Clinical health psychology has really been a rewarding career for me. But one of the things that I want to talk about is how our program is a clinical health psychology program, and we really emphasize the health here. And for the right student who loves that intersection between psychology and health, this is really a perfect program for them. Now, not everybody knows what clinical health psychology is, but think of it this way. If you're somebody who is excited about learning about that intersection between psychology and health, if you're interested in helping people to prevent poor health or to recover from certain health conditions or diseases, if that excites you, this may be the program for you. If you're interested in areas like heart disease or diabetes or cancer, weight loss, sleep medicine, mindfulness, again, this may be the right program for you. And once you identify the content that you're excited about, I think it's important next to consider the important aspects of the learning environment. So we consider ourselves to be a scientist practitioner model. And what that means is we're going to train you to be an outstanding scientist and an outstanding practitioner. So when you start with the practitioner part, we are training people in cutting edge clinical skills and training. We are a twice recipient and current holder of a Health Resource Service Administration Graduate Psychology Education Training Grant. In there you learn primary integrated care psychology. You're working side by side with doctors and other health professionals. We're teaching you opioid use disorder treatment, trauma-informed care, the social determinants of health, chronic pain, telehealth. It's just an outstanding clinical opportunity. The flip side of that is the scientists, the research scientist side. And the faculty here at East Carolina are top-notch, national, international reputations. And these are people who mentor your research, and you're involved in their research labs, and you're publishing with them. So again, you get the outstanding research skills, and you get the outstanding clinical skills. Beyond that, beyond the learning environment, I think you need to ask yourself about the social, emotional environment. What is it like to work with the faculty here? What is it like to work with the other students here? And this is again an area where I think we really shine. This is what I would call a rigorous and a nurturing environment. Rigorous, it's a doctoral program. We all work very hard to do our best, whether it be research or clinical work, but it's nurturing too. The faculty are very caring. They really care about the students, and they want to see them succeed. This is not an environment where you get chewed up and spit out, or the students are backstabbing. At any given day, you come into the department, you will see students helping each other, and you'll see students being treated as junior colleagues by the faculty here. And so, you know, I think once you've decided on the content and you've gotten your education here, I think the last thing you got to ask is, where is this degree ultimately going to take me? You know, will it get me a good internship, a good postdoc, a good job? And I'm here to say absolutely yes. Outstanding internships. Our students go on and they end up going to places like Brown, the Cleveland Clinic, Yale. If you're interested in more local schools, we have students that end up at UNC Chapel Hill, at Duke, Medical University of South Carolina. And so our students end up with very excellent jobs, very lucrative, probably more lucrative than I make. But I think that the point is, why is that? Why are our students getting such good jobs? Well, first of all, they have outstanding talents. They've learned great skills, and I think it's that combination: taking great students, teaching them a skill set that's highly valued, and they end up just getting wonderful jobs. And so I think from the very beginning, from our content area to our learning environment to our social emotional environment, right out until you get your first job, this is really an outstanding program. I hope you enjoy the rest of the program and take a little time to look at our website, and then ultimately I hope that we see you in the fall. Thank you.
Hi, I'm Christy Walcott. I'm the Graduate Program Director for Pediatric School Psychology, which is one of the concentrations in the Health Psychology program here at ECU. We're really excited that you've taken the opportunity to learn more about our program, and I just want to let you know a little bit about Pediatric School Psychology. So it's kind of a unique area because it's a blend of pediatric and school, but what I want you to know is that we are first and foremost a school psychology training program. So we're accredited by the American Psychological Association as a school psychology program. And what's cool about that is in your first 2 years, you're going to join forces with our specialist program in school psychology and take lots of core courses in how to be a great school psychologist. It's in the third year when they go off to internship that you'll stay, and your doctoral training will involve that special emphasis on pediatric and health psychology. So what's cool about this is we have graduates that land all over the place. So we have folks that end up in school systems as school psychologists. Some even rise to administrative positions as lead school psychologists. We have others that have chosen to go into medical centers and medical areas, like working in pediatrician offices as doing integrated care. And we have others that decide they really like the academic experience of graduate school and they want to keep on doing it. So they end up working as university professors or teaching at college level. So as you can see, there's a lot of ways you can go with your pediatric school psychology emphasis, and we think it's a really unique thing about our program. In fact, you can find lots of programs in school psych and several in pediatric, but very few that blend those two together. And it really has a unique position for you to kind of be a liaison between all those systems and do great things for children and families. So thanks for your interest in our program.
Hello, my name is Tony Salucci. I'm really proud to be part of the ECU doctoral program in health psychology. I've been at ECU for 10 years and we have a fabulous program. My specific role in the program is the director of the PASS clinic. Most training programs, about 70% of them, have an in-house clinic so that students are provided developmentally appropriate experiences in training. The clinic's mission is to be a center of excellence in training in clinical health psychology and also for the school PEDS program in health psychology. Our mission, while training is paramount, we also provide needed services to Greenville area and surrounding communities, as well as to the campus community. So faculty members who are licensed and have specialty services work in the clinic, and currently we may have 4 or 5 different specialty services that I could briefly talk about. Dr. Carroll's provides a healthy weight training experience in health weight management. Dr. Whitehead provides specialized training in behavior therapy, focusing on depression and anxiety disorders like OCD. I myself run a generic cognitive behavioral therapy practicum where we look at people's presenting problems and focus on a cognitive case conceptualization and short-term skills-based empirical treatments. We also have a school PEDS specialty service for both evaluation and treatment of children, which Dr. Thurnick and Dr. Walcott have been involved in. So the clinic is actually one place where the health psychology students, both in the school PEDS program and in the clinical program, could interact with one another in terms of their background and knowledge in health psychology. In the cognitive behavioral therapy practicum, our focus is on helping people understand the problems they're having in terms of specific thoughts, behaviors, and affects, and how those interact in their coping with often difficult situations. We unfortunately see a lot of trauma at the clinic. About 1/3 of clinic patients report having significant trauma experiences. We help them process and come to different understandings and ways of handling how those traumas have affected them. We don't have a physician at the clinic, but we work well with people's primary care providers and the ECU providers for those patients that would also benefit from psychotherapy, but also medication. For people who are more chronically and seriously depressed, often a combination of cognitive behavioral therapy and medication is the most effective treatment. The clinic is a small facility, but has a number of important resources. We have 5 or 6 therapy rooms, a group conference room, several testing rooms. We have created a library of specialized treatment resources, treatment manuals, and other things that clinicians can do on-site. Library searches, looking at evidence-based interventions, looking up medical problems. We have an EMR, electronic medical record system called Titanium, as well as filming capabilities, so all sessions could be recorded for supervision and immediate feedback to the clinician. Trainees in the clinic get both experience with assessment and evaluations and also with treatment experiences on the various practicum teams.
Hello, my name is Taylor Zerlinden and I'm a doctoral candidate and a 4th-year student in the Clinical Health Psychology program here at ECU. You've already probably seen a little bit and heard about our ECU Pass Clinic, but I want to tell you a little bit about our in-house clinic. It's really a great opportunity for you to get those foundational skills and to be able to receive constant supervision and just really get a lot of feedback. I am personally really interested in neuropsychology and specifically traumatic brain injuries. So what's been great is now that my supervisors know that, they've allowed me to take on unique experiences working with patients who might present with these conditions. So it's a really great opportunity to get some experience and to also get a lot of supervision and oversight. One of the really great things is that the department clinic has a ton of resources, which is awesome because we can get exposure to different tests and measures we might use in the future, and we can also use different manuals and treatment approaches that we might not otherwise have exposure to. As somebody who's leaving for internship soon, I feel really well prepared for whatever interviewers throw at me and whatever my future career throws at me as well.
I came to East Carolina with my master's degree already, so I've had some experience with therapy and with assessment prior to coming here. Something unique about working here at the ECU Pass Clinic that I've really valued is that the supervisors and faculty have really helped tailor my learning experience as a clinician and therapist in training to the experience that I've already had prior to coming to ECU. We have faculty that specialize in a variety of different areas, including behavioral treatments, cognitive behavioral therapy, substance abuse, neuropsychology, and so on. Professional services are offered in the areas of clinical expertise of our licensed faculty supervisors. Because we are part of a major research university, our faculty supervisors and student therapists employ evidence-based treatment methods. We are fortunate to have experts in several specialty services or areas of practice, and our students are supervised in the delivery of these services. If you get trained here at East Carolina, you can do it all.
My name is Dr. Jeannie Golden, and I'm an associate professor in the Pediatric School Psychology program. And I wanted to tell you about a great opportunity we have here at ECU. In the Pediatric School Psychology program, you can also get a national certification as a behavior analyst. And that is really something that gives you a toolbox of things that you can use to understand children, to work with severe behavior problems. And a lot of times people think of applied behavior analysis as only working with children with autism and developmental disabilities. But it is really helpful for classroom teachers to use with students that have disruptive behavior. It's wonderful to use the principles and strategies in doing consultation with teachers and working with parents, in giving parents strategies for working with their children. And a lot of times, very young children, 3 or 4 years old, parents bring them in for assessment because they feel like they have ADHD or conduct disorder or oppositional defiant disorder or bipolar disorder. But the nice thing about applied behavior analysis is it's a series of techniques where we work on behavior. So we don't necessarily need to have a diagnostic label. We can just work with kids and help to improve their behavior and give strategies to parents to help improve their behavior. I started off in special education, and I had these students who had all failed the functional literacy test in Florida, and I showed the list of students to my principal, and he said, "You don't want those kids in your class. Those are all the bad actors. They're the ones that get kicked out of school, suspended, get in trouble with the law." And I said, "Those are the kids I want in my class." And I used all my behavioral techniques that I had learned. And the first day of class, I closed the door, I looked up at my students, and I said, "In my class, nobody goes to the office." And I looked up at them because they were mostly male and mostly bigger than me. Well, I kept that promise. And the reason I was able to do that is I had this special toolbox of strategies and techniques that I could use that were from applied behavior analysis. Now I'm in school psychology, and I love sharing those techniques with students, not only to use in the classroom, but also to use in settings with children with autism and developmental disabilities, as well as in clinical settings to work with kids who have behavioral issues and work with their parents. It's also helpful for medical settings, for treatment compliance, medication compliance, exercise, dietary. There's so many things that you can use applied behavior analysis for. It's not just limited to one particular discipline or one particular type of population. The Pediatric School Psychology program has wonderful training in school psychology, in pediatric psychology, and then if you also want to work on this certification and learn these strategies and principles, there are classes that I teach in applied behavior analysis, and there are also practicum placements that you can do. So what you need to do if you're interested is come talk to me, and we can set you up in the type of practicum placement you would like. For example, if you want to work in a setting with children with autism, we have that available. If you'd rather work with more typically developing kids in our PASS clinic who have behavior problems and you want to work with their parents, you can do that as well. If you want to work in a school setting and work with kids that have behavioral issues there. So we have a variety of opportunities for you to get experiences. And one thing that I like to do is I had a mental health grant for 10 years, and we did school-based mental health where we worked with kids in schools that had a lot of poverty and backgrounds where their parents were incarcerated, substance abusers, maybe they worked 3 jobs and they weren't very available. And a lot of these kids had anxiety, depression, some of them were suicidal, and we actually used a behavioral approach to handle these mental health issues. So again, there's a variety of settings and situations in which applied behavior analysis is applicable. So if you're interested in gaining those skills and seeing how applied behavior analysis can work in conjunction with other psychological techniques, well, please come and talk to me. I'm Dr. Jeannie Golden. Thank you very much.